Today is Medical Monday. Thanks to advancements in medicine, we are living longer today than ever before. But it's not just about the number of years. It should also be about the quality of years. Senior care is one of the fastest growing practices. For many people, especially seniors, the problems range from accessing quality health care to affording it and knowing what programs are even available. Joining us with how Legacy Community Health can polish up your golden years by streamlining the process is Chinelo Nweke. Good morning, Chinelo.
Good morning.
All right, Legacy Community Health. How many times do you find seniors, probably like the rest of us, show up for health care when we're in crisis versus showing up to avoid the crisis?
Oh, it's more often than we would like. I think that's one of the things that we focus on, especially within our clinics, is really just emphasizing the importance of prevention and trying to be more proactive with your care instead of reactive and coming in when you're sick or that diabetes is sky high or your blood pressure is through the roof. So it's really important that we get that primary care started early on.
Yeah, let's explain. So this section that we're talking about, senior care, is probably part of being under a full umbrella of what Legacy Community Health is.
Yes. So Legacy has been around for over 40 years servicing the Southeast Houston area. So we have clinics all throughout Houston as well as Fort Bend, Beaumont, and Baytown. But the senior care primary service line was just specific to expanding Legacy's mission, which is that we believe that everyone should have access to care. And so this was just another commitment to expanding that mission.
Yeah, especially when you get into senior care. What we find kind of on both ends of the spectrum, you know, when you're starting out in life, pediatrics, and then on the other side of life in senior care, it starts with having a great primary care physician, kind of like the person who can oversee things until or unless you might need a specialist. But a lot of times seniors will say, oh, well, it's hard to find a primary care physician because no one's taking new patients.
Well, that's the great thing about us is that we are always taking new patients. We want to make sure that everyone has that access. And so you can give us a call, visit our website, or even just walk into the clinics and ask about scheduling an appointment, and we'll be happy to get you facilitated.
Yeah. When you mentioned walk into the clinics, you all thought about everything, even making it convenient for seniors. In the space is a little bit different, and the times with doctors is a little bit different.
Yes, so there is so much attention to detail within our clinics, from handrails to the beauty and the design of the clinics. Everything is specific to making sure that older adults feel comfortable. Yeah. But also,
I'm gonna say I've been in there before, and I'm like, this place is really pretty. I don't feel like I'm in a which is the point, right?
Exactly. That's exactly the point. We want them to feel comfortable and feel that this is a place where they can have those intentional and meaningful conversations, but also forge a relationship with that clinician, which is going to help them live healthier longer.
Yeah, and those relationships can be with so many different people. The Legacy Wellness Senior Care model. I mentioned longer appointment times, but also other people who, you know, I think we've been trained over the years that you always go to the doctor. Well, the doctor for certain things, but there are so many other things that play into our healthcare as well. For example, nutritionist.
Yes, so we have a registered dietitian on staff. We also have geriatricians who are clinicians trained to care for older adults, so they truly understand that journey of aging, but they also are supported by a geriatric psychiatrist, a social worker. We've got a wellness manager specific for fitness, as well as a clinical pharmacy specialist. Yeah. So really a robust team.
And that pharmacy is so important, especially when you start looking at things that could have contradictions. Say, what else are you taking? Let's spread it all out here. Or I've seen a case where the senior said they couldn't afford the medication, so they were splitting it. And they're like, no, we can help you out with that. You know.
Yeah, and that's one of the amazing things about Legacy is that we have our own pharmacy. So that pharmacist is available to not only educate them about the medication, like you said, but also help them access the medication through our pharmacy or as well as contracting pharmacies that support us.
All right, even if you're feeling fine, you think everything is good, it starts with the annual wellness exam.
Yes, yes. The Medicare wellness visit is a visit that we really try to promote to our patients who have Medicare because it's free of charge and they can get it once a calendar year. But for our uninsured patients or patients who are not old enough for Medicare, we still encourage annual exams because that prevention is really key to helping them live healthier.
And seeing, you know, unfortunately, oftentimes when you're older, things can take off faster, right? And even like a UTI that starts out as a basic UTI is not basic in older folks.
Yes, and so that's another benefit about prevention is that it allows us to really sort of take action before things get worse. It helps us reduce hospital admissions, ER visits, again, like you mentioned, some of the other diseases that are common for older adults. And so being on top of it is really what we really try to encourage for our patients.
Because this is how we are. It's like if you have diabetes, you go, okay, they gave me my medication, I'm all good, I'm feeling fine now. Okay, still go in, because we want to make sure you can be feeling fine, we want to make sure your body's doing fine.
Exactly.
All right, you also have social service specialists, which I think is, it just shows kind of the thought that you put into this, because so many times this was so much more under the spotlight during COVID. So many seniors were isolated, and they'll just be inside their homes and not get out, and really getting out and socializing is so important to their well-being.
You know, there are so many things I love about my job, but this might actually be one of my favorite ones, because I think there is something to be said about having the opportunity to engage with others who are navigating the same journey as you. And so we have free events every month that allow patients as well as family members or anyone in the community to come out and be educated on things prevalent to them, but also they're just a lot of fun. So whether that's a healthy cooking series or something for Heart Healthy Month, we have something that really just allows them to engage and learn more.
Yeah, because I know one woman, she goes, oh, I'm going to go on up there and just kind of hang out for a while. I was like, that's your new club, isn't
and
it?
We love it, and we love it.
Yeah, she said that's like her club. And then just confusion over paperwork. That's another thing that might stop somebody from coming in saying, am I covered? Is this going to be taken care of? You walk people through that.
Yes, we have eligibility specialists available to support our patients. Our front desk team members are also very educated on helping patients navigate that. And we have a new medical record system that really allows us to streamline so many things. And so it's a lot easier to go into the doctor's office.
Yeah, and I love that whole the new medical record streamlining type of thing, because we're all hard pressed to tell you where half our records are, right?
Exactly.
Yeah, so that way they'll have that there. And there's that examination, the IPPE, that's where a lot of that can start.
So that's part of the Medicare Wellness Visit. And so for patients who are brand new to Medicare, they've just turned 65 in the first 12 months, they have the opportunity to complete that initial preventative exam. And that's really where the personalized prevention care plan begins. And then every year as you meet with your clinicians, as well as throughout the year, we're just expanding and building on that plan to make sure that we are moving in the right direction with your care.
Yeah, thank you so much for that information. There are a lot of folks out there who, they're moving into that new phase of life, and so this is something they definitely need. And I'm gonna end with this. I know it's just completely off topic, but I'm definitely gonna need that suit you're wearing. Okay, very pretty. All right, with immediate appointments available, including new patient openings, Legacy Senior Primary Care is here to help you stay healthy. They have 5 convenient locations in Houston surrounding areas, 2 located in Houston, Missouri City, Stafford, and Baytown. Call them at this number here at 713-814-3655. Again, that's 713-814-3655. For more information and to schedule an appointment, to learn more, visit LegacySeniorPrimaryCare.org, LegacySeniorPrimaryCare.org.